The drop arm test tests the rotator cuff strain. The subject is standing and the practitioner is standing. Examiner passively abducts subject's involved arm to 90 degrees and then instructs athlete to slowly lower the arm to the side. A positive sign is subject is unable to slowly return arm to the side. The apprehension test tests for anterior or posterior dislocation. The subject and practitioner will be standing. With the subject's involved arm to 90 degrees of abduction, the examiner slowly externally rotates the shoulder. Positive sign is the subject looks or expresses feelings of apprehension towards further movement of the humerus. The belly press tests the rotator cuff. Examiner is standing and subject is standing. Bend arm to 90 degrees at the elbow with the flat hand. Place it on your belly. Then patient will firmly press their palm on their abdomen. Positive sign is full internal rotation is no longer possible. Ruse test. Subject and examiner will be standing. Subject is standing with both shoulders in 90 degrees of abduction and external rotation and the elbows at 90 degrees of flexion. The athlete rapidly opens and closes both hands for 3 minutes. Positive sign is instability to maintain the test position. Speeds test. Subject is standing or seated. Examiner is standing. The test tests for biceps tendinitis. Subject is seated or standing with shoulders flexed at 90 degrees and fully extended and forearm supinated. Examiner places hand on forearm and on bicipital groove. The examiner resists the subject's attempt to actively flex the shoulder. Positive sign is tenderness and pain in the bicipital groove. Test. Subject and practitioner will be standing. This test tests for anterior and posterior instability. Stabilize shoulder with other hand. Grasp humeral head. Compress joint. Apply posterior pressure to see if there's any available movement, and then anterior. Positive sign is pain or weakness. Sulcus sign tests for glenohumeral joint instability. Examiner and athlete will be standing. With the scapula stabilized, apply and downward force to the humerus with distal hand. Positive sign is excessive slipping of the humerus. The empty can tests for strain of the supraspinatus. Subject and practitioner will be standing. Subject stands with both shoulders abducted to 90 degrees, horizontally adducted to 30 degrees with thumbs pointed down. Place downward pressure on wrist. Positive sign is weakness or pain reported over the supraspinatus. Job relocation test. Examiner is standing and subject is supine. An external rotation following the apprehension test, then find out where they stop. Then you will pull back into a more comfortable position. Apply pressure at the anterior glenohumeral joint. Push down, then slightly reduce pressure on the joint. Positive sign is pain. The Jorgensen test tests for biceps tendinitis. Subject is standing and examiner is standing. Subject is standing with elbows flexed at 90 degrees and fists turned down. The examiner resists the subject's attempt to do the uppercut while trying to supinate the forearm and externally rotating the humerus. Positive sign is pain that is reported in the area of the bicipital groove. Apley scratch test tests for range of movement of the glenohumeral joint. Athlete and practitioner will be standing. Ask subject to touch opposite shoulder from the front. Ask athlete to reach behind the head to touch the opposite shoulder. Ask subject to reach behind the back and touch the opposite scapula. Positive sign is inability to perform the task. The serratus anterior wall push-up. Examiner and athlete will be standing. Put arms straight up in front of you on the wall. Bring your shoulder blades forward, then back. Positive sign is pain. O'Brien's test. Examiner and subject are standing. Examiner places a glenohumeral joint into 90 degrees of flexion, 15 degrees horizontal flexion, and you will pronate the arm. Examiner will apply downward force, palm up, then apply downward pressure. Positive sign is pain or clicking.